Welcome to MedX 360. I'm your host, Sheri Jamkhou. Today's guest, Samara Mahindra, is the founder of CARER, a personalized cancer center in New Delhi, India, who believes in healing cancer the right way. Samara, it's a pleasure to have you on the show. Now to my first question, what motivated you to start CARER? When did it begin? And how many patients has your facility treated?
So my motivation was a very personal endeavor with cancer. I unfortunately went through cancer as a caregiver because my mother was diagnosed with it, and unfortunately she couldn't survive it. But that's when my journey began with cancer and with the company we've built today, CARER, where we essentially manage non-clinical supportive therapies for patients to improve their quality of life. And today we have been very fortunate to treat thousands and thousands of patients. As you can imagine, we come from a country like India where the population and the cancer numbers are rising. So we're, approximately thousands of patients per month is what we treat.
How would you define integrative medicine? That's something that CARER does, I believe. So if you would just define that for us.
Correct. So integrative oncology and integrative medicine is a very well-established way of treating patients around the world. So if we were to look at any major cancer hospital in any developed country, whether that's the US or UK, you would find integrative medicine units. And these cancer hospitals would have non-clinical therapies along with mainstream cancer treatment. So when we speak about mainstream cancer treatment, we're talking predominantly about chemotherapy, radiation, surgery, immunotherapy, hormonal therapy. Now, integrative medicine is integrating the non-clinical aspects of care. This could comprise of personalized clinical nutrition, physical therapy and physical rehabilitation, mind-body therapies, psychological interventions that have now proven to improve the outcome of the patient, the clinical outcomes of the patient, expedite healing, and help the patients respond to treatment better.
What is the concept of treating cancer patients as a whole and not just attacking cancer cells? And what types of non-clinical treatments do you provide?
So when we look at cancer, unfortunately, it affects you on all levels. So it affects you physically, mentally, psychologically, nutritionally. It actually affects the entire family and the community. When we're treating cancer, and today, unfortunately, majority of cancer cases is lifestyle related. It's because of smoking, sedentary lifestyles, ingesting the wrong food for a long period of time, suppressed immune systems, unbalanced hormonal disruptions. So multiple lifestyle related factors are actually causing cancer today. So when we're treating cancer just through the medicine alone, the lifestyle part of it is not being taken care of. And that's why using nutrition, physical therapy, psychological interventions to improve the outcomes of the patient and treat a patient holistically. So not just the symptoms and not just the tumor, but treating the person has now proven to have a huge impact on how the patient actually survives and how their relapse rates go down. Now, the way we deliver these therapies is very evidence-based. It's very scientific in nature. People don't understand that just giving a diet plan or finding a diet, a cancer diet plan online doesn't work. That every patient and their dietary intervention and regimen has to be very, very different, very personalized to them. And it's based on their pain points, their diagnosis, their prognosis, the treatment protocol they're on, comorbidities, their lifestyle, so on and so forth. So the therapies delivered by us are delivered through onco specialists. So they are medically trained and then they're trained further in oncology. And so they understand the A to Z of the treatment. They understand the A to Z of the diagnosis and the disease itself, and what would be the best intervention for that. So when a nutritionist writes a diet plan for a patient, she or he completely understands the food and drug interactions, what kind of food is available for that patient, and what kind of foods would be best suited for his or her condition.
From your experience, how does cancer affect a patient's mental and psychological well-being?
I feel the psychology part of it is probably the most integral part of any cancer patient's journey. If I were to just speak about a personal experience, while my mother had access to phenomenal medical treatment, and we were very fortunate for that, and had all the support at home, the psychology element was completely amiss. And unfortunately, we come from a country like India where mental health is still not embraced as much as it should be, and that it's still very stigmatized. So when we work with patients, they straight away think that there's nothing mentally wrong with me, so why should I get a psychologist? I have my family members to manage this. But what we've realized is a lot of the healing actually happens once you accept the diagnosis. It's very common that once you're given a diagnosis, you go into this "why me," which is inevitable. We would all feel it, and we did this, and I did this, and I did everything right. Where did I go wrong, right? But when you have professional mental health experts to guide you through that, to actually give you tools to implement, to manage stress better, to manage sleep better, to help you kind of get through bouts of depression, if that might be, fear of relapse. These are all very relevant and pressing side effects that happen psychologically for any cancer patient. So that really helps them expedite their healing. They're able to embrace their journey better, and they're able to actually bounce back quicker.
Absolutely. Now, what do you think that cancer patients and their lifestyles, contain? Do you think that they can ever go back to their old lifestyle, or do they even try to go back to their old lifestyle, or do they just embrace this new life, let's say, after treatment?
So it really depends, and this is where supportive integrative therapies come into play, because they need the support to go back to, your life is kind of disjointed to a certain degree. You're seeing a very different life for a couple of months or those couple of years while you're going through treatment. So kind of coming out of that is a new reality for them. Now, this is where you really need the support to, wean you back into normalcy. There are many times where we're unfortunately seeing more and more patients at a younger age. This is the working population. How do they go back to their working lives? How do they communicate with their colleagues? How do they get back to the high level of productivity they had? So there are many things that really they need to take into consideration when they go back to their old lifestyles. Now, it really depends on, are they going back to an old lifestyle? Are they embracing something new? And is that better for them? Many a times, which is, makes me very happy to say, is that a lot of our patients live even healthier lifestyle after. I mean, once you kind of, experience something like cancer, which is like almost a near-death experience, they become healthier than they were before. And then there are those, unfortunately, where in head and neck cancer cases. So these are cases, or these are cancers that happen in the head and neck region. Now, in India, it's predominantly because of chewing tobacco, smoking, or drinking. And this is predominantly happening because of an addictive personality. They're addicted to the substance. So they can be treated for cancer, and the cancers happen purely because of this, chewing of tobacco. But then no one is treating the addiction. So when they go back to their normal life or post-treatment, they're back to chewing tobacco.
Right, absolutely. Definitely lifestyle changes look like they're mandatory when it comes to post-care. You also mentioned the importance of family support. Does CARER actually provide assistance to families as well, or just to the cancer patients?
Well, me being a family member or caregiver for so many years, and that being the reason why I started CARER, was because of what I experienced as a caregiver with my mother. There was no way that we were building a support system and not including the families, and the entire family actually a part of this protocol. So initially, we would make it an option to have family members also be a part of the counseling and the mental health support. And then, of course, as you can imagine, a lot of them turned around and said that, no, let the patient have all the support and we're okay. But in fact, it's the caregivers sometimes that need more support. And so we made it almost mandatory now, where every caregiver gets access to a mental health expert. And in fact, we involve them into the journey. So if a patient is having a yoga session or a physical session or a meditation session with their therapist, we invite the caregivers to be a part of it as well. And that really creates a healing environment for that patient as well.
CARER appears to offer a more comprehensive approach to cancer treatment in addition to conventional methods like chemo, radiation, and surgery. Can you elaborate on the other types of treatments that CARER provides?
We provide all the non-clinical support, and this comprises of three major elements that actually makes up your lifestyle. So one is the nutrition. So we do the A to Z when it comes to nutrition, personalized nutritional intervention for patients. Two is physical therapy. This can be in the form of yoga therapy and meditation or physiotherapy. And three is the mental health support. So we have some phenomenal clinical psychologists and psycho-oncologists who work very closely with our patients and caregivers. So that's what CARER offers. But we work very closely with the medical side of treatment. So we work closely with the oncologists, with hospitals, with pharmaceutical companies who provide and administer the drugs and the medicine and the conventional treatment, while we manage all the other elements of care for that patient.
Now, what lifestyle habits do you believe are most effective in preventing cancer besides maintaining a balanced diet, regular exercise, and avoiding smoking?
I think that just keeping, an active lifestyle, we unfortunately are becoming very, very sedentary in the way we live our lives. And these high fat percentages is causing disruptions with our hormones. It's leading to multiple types of cancers. I don't condone anything too extreme. I know of people who want to be vegan, raw, just the extreme of things, and I think that itself is not very healthy in a way. I feel that being in moderation with everything and just maintaining a healthy lifestyle, keeping fat percentages low, just spending some time in just being conscious of your mental health. And then, of course, we cannot deny the fact that it all lies in screening and detection. I mean, if you want to see, and I say this all the time, we want to see a cancer-free India or cancer-free world, it's all about screening and early detection. So you have your lifestyle and you can take all the precautions there, but you have to do your screening. And the earlier you find cancer, the earlier you pick it up, the higher possibility of just 100% cure and survival.
Yeah, absolutely. Now, after surgery, some patients suffer from a lymph blockage, especially with, the case of breast cancer. And you've spoken in the past about lymphatic drainage. Now, how long can a patient come for a lymphatic treatment after recovery to CARER?
So it really depends on the type of surgery they've gone through. I mean, if a patient has had a double mastectomy, that is the removal of both breasts, then that's quite a traumatic and extensive surgery. So you're not going to go straight into physical therapy right after. So we always get clearance from the doctor. We say, at least a minimum of 6 weeks is what we require. But that is a call that the doctor signs off on, as well as the physical therapist signs off on. When it comes to lymphatic drainage or lymphatic therapy, unfortunately, most patients don't even know about it. So if you have a lymph node, even one lymph node removed or radiated, you are at risk of lymphedema. Now, lymphedema comes in stages, and once it reaches a particular stage, I believe that's stage 3, it's irreversible. So it's almost like elephantitis, and there's extreme swelling and extremities. So it becomes difficult to even live a normal life. And hence, we always encourage lymphatic drainage exercises. We encourage wearing compression sleeves or compression garments to kind of keep the lymph and fluid passing through effectively and easily. But there are a lot of lymphatic drainage movements and exercises that you can do post-surgery. You don't even need to really go to a therapist. You can actually just see this online, as long as it's, again, something that you consult your doctor with. You must practice this on an everyday basis.
Absolutely. Samara, thank you very much for your insight today. It's been wonderful. And it's been a pleasure to speak with you.
Thank you so much for having me. It's been a pleasure.